So there seems to be a connection between insulin resistance and a lot of health conditions, but let's just take a step back here and define what exactly is insulin resistance and how does it develop?
Okay, insulin resistance means that the cells that are supposed to be responding to insulin aren't responding. Insulin is, of course, a hormone that is made in the pancreas, and it acts like a key. So when it arrives at the surface of a muscle cell, it actually attaches to an insulin receptor, just like a key in a lock, and that opens up the cell membrane to let glucose come inside. So if a person has type 2 diabetes, normally the glucose should be able to be escorted into the cell by insulin, but the cell is just not responding to that insulin very well at all. And up until comparatively recently, people reacted by saying, okay, don't eat so much sugar, don't eat carbohydrates that will release more sugar into the blood because you're insulin resistant, you can't handle it. Our response is different. Our response is to say, wait a minute, your cells are supposed to work with glucose. They should be able to take glucose out of the blood. Let's tackle the insulin resistance. Let's fix that if we can. So that raises the question of why. And we can see why. You stick the patient into an MR machine, magnetic resonance spectroscopy, and looking into the muscle and liver cells, what you discover is they're filled with microscopic fat particles. That's stopping insulin from working. So to make it short and sweet, if I can get fat, accumulated fat, out of the muscle cells will respond to insulin again, and the sugar can get into the cell and out of the blood, and my diabetes should get better or even go away if it's type 2. If I've got type 1, the same thing will occur, except I can greatly reduce my insulin need, but I'm not going to completely eliminate the need for taking some insulin.
Okay, so this is actually super helpful because you're also a master of teasing apart the difference between sort of the long-term difference between low carbohydrate diets versus low fat diets. So can you talk a little bit about how a low carbohydrate, high fat diet influences the development of insulin resistance?
Yeah, I have to say I'm really kind of troubled by this, that we're seeing a whole lot of periodic enthusiasm for a low carbohydrate diet. It started with Atkins, and then it kind of died out, and then it came back as South Beach, and then it sort of died out, and it came back as ketogenic diets. And when these low carbohydrate diets recur, you can sort of understand why that would be the case, because people have high blood sugars, and they figure if I stop eating sugar and carbohydrates that turn to sugar, my blood sugar will fall, and it does. But you're not really attacking the source of the issue, which is the buildup of fat inside muscle cells and inside liver cells. So now when people go on low carbohydrate diets, because carbohydrates are, 50 or 60% of what a person eats. I'm talking about all your fruits and beans and whole grains and so forth, starchy vegetables. If you take all that away, you are eliminating a lot of calories that people will lose weight. And if they lose weight, they're going to lose some body fat. And if they lose enough fat, you will sometimes see their glycemic numbers improving, that their A1C might come down and so forth. The problem, there are many problems, but from my standpoint, the biggest problems that we are left with is that the foods that remain in the diet are meats, gravy, foods that tend to cause cholesterol to rise. And the reason that's such a problem is that what's going to kill a person with diabetes, in most cases, is vascular disease. Their blood vessels are being attacked, their heart is being attacked, the tiny blood vessels to their eyes or the tiny blood vessels in their kidneys are being attacked by this disease. So you don't want to raise cholesterol levels. You don't want cholesterol in your diet at all. And there have been a couple of recent studies, fairly large studies, where we've seen increases in bad cholesterol on the order of about 10 or 11% on average in people doing these low-carb diets. If you take a population of people and you raise the average bad cholesterol by 10%, that's a lot more vascular disease than we would otherwise have. So I'm concerned about people jumping on these diets, hoping for short-term weight loss, but ignoring the long-term risk.
Would you say that a low-carbohydrate diet worsens insulin resistance? It makes somebody more insulin resistant?
It can. The effects of these are really varied. Yes, I think it certainly can. If you're eating, a typical case is this: a person hears that if they avoid carbs, they're going to lose weight, and so they avoid carbs, but they end up eating more fatty foods, and They may end up not losing much weight because their calorie intake hasn't really fallen very much. And then now more and more fat is getting packed into their cells. And that's a person who discovers they're getting a real double whammy. Their blood sugar doesn't get better. Their weight loss is nothing to brag about. And everything else gets worse, where their lipids get worse, and often autoimmune conditions get worse. And that's a person who then abandons the low-carb diet, starts swearing at it. In other cases, there are some people who will do it as sort of a semi-starvation kind of thing, where they're really avoiding so many sources of calories that they do actually genuinely lose weight. And it wouldn't surprise me to see in some cases their insulin sensitivity actually improving a bit. But it strikes me as the hardest possible way to do it and the most dangerous way to do it. Because again, you want to bring into your diet the things that will protect you. That's things that lower your cholesterol, but also the foods that protect your cholesterol. Keep this in mind. You know, all these particles of LDL cholesterol circulating in your blood, what makes them get sucked into the artery wall is because the LDL particles are oxidized. And we need antioxidants in our diet to a rich degree to protect them. So that's fruits and vegetables and all of the good micronutrients that they contain. So when you raise your cholesterol and you take out all your antioxidants, you're really asking for trouble.
So you've touched on the connection of insulin resistance and people living with diabetes to cardiovascular challenges. What other conditions stem from insulin resistance, and how can they be prevented?
Yeah, well, there's a lot of other conditions really that stem from this diet process, and I want to focus on that for just a minute. When a person greatly increases their meat consumption, then we have the risk not only of Alzheimer's that we talked about earlier, and to put a number to it, the Chicago Health and Aging Project back in 2003 showed that people eating the most saturated fat had 2 to 3-fold higher Alzheimer's risk compared to people eating the least. So that's risk number one. Risk number two is what happens in your digestive tract, where all this meat and so forth is going, meat and gravy and heavy cream is going down. We see higher risk of colorectal cancer in people eating meat. This is particularly true for red meat and processed meat. And unfortunately, we've seen in the low-carb camp the idea that you can't be harmed by eating a whole lot of meat. And unfortunately, that's a great concern. So some of us refer to low-carb eating as sort of a faith-based diet. In other words, you have faith that all the scientists so far have been wrong, that hopefully cholesterol won't hurt me, and hopefully meat won't give me colorectal cancer, and it hopefully won't affect my brain. But I have to say, I think science up until now has given us really good clues about what foods put us at risk. And all of those are front and center in this kind of diet.
Okay, so earlier you actually touched on something that I think was really important, which is that when people adopt a low-carbohydrate diet, whether it's a paleo diet or a South Beach diet or an Atkins diet or a ketogenic diet, they often find that they lose weight. And as a result of the weight loss, their A1C comes down, their blood glucose comes down, and they can improve maybe even their blood pressure. Is it true that weight loss is required in order to elicit those results and improvement in diabetes health? Or is it possible for somebody to adopt a low-carbohydrate diet, not lose any weight, and then still improve other metrics of their diabetes health?
I would be surprised if that were the case. Now, if you go on a completely plant-based diet, no animal products, keep oils low, let's say a person's already skinny and they don't lose any more weight, but you will see their diabetes improve, you'll see their LDL improve, you'll see their blood pressure improve, independent of weight loss. When people go on low-carbohydrate diets, the quality of the diet is so bad that you're typically not going to see these other improvements. Now, when a person loses weight, by any means, it doesn't, whether you're going on a low-fat diet or a carb-restricted diet or you're fasting or whatever it is, typically your total cholesterol drops about 1 point on average for every pound you lose. So no matter how you lose weight, people's cholesterols improve. But the exception to this has been low carb, where you see people losing weight because they're avoiding so many foods that they would normally eat. But because their foods are high fat, high cholesterol, there you see the average person's cholesterol, instead of falling, it actually worsens. There's a lot of variability, though. There are some people who will swear they see a big cholesterol drop. That's what should happen, paralleling weight loss. But there are a lot where they rise. Sometimes they rise to a frightening degree. And so we see cardiovascular risk going kind of off the scale there.